I've been giving little in services here and there to everybody else on our staff as they're using it.
Okay. All right. Good.
But yeah, we've actually really enjoyed the experience so far. Probably our best success story is just the patient that hadn't stood in 130 days or something. He was non-weight bearing on one of his extremities and he has a ton of wounds. We were super pleasantly surprised by just the ability for him to move without shearing, doing like some like one-legged squats, which was great. And it like actually helped him progress to being able to stand outside of the bed, which is it was so wonderful. Patient was crying, the family was crying, everybody was just super excited. Yeah, that was probably our like best success story with it. It's interesting just with some of our ICUs, the rooms are a lot smaller, which we've run into, especially in our older buildings. We have a newer surgical tower and the rooms are huge and there's no issues with that whatsoever. It's really nice actually. But
Were you
yeah,
able to the smaller rooms or?
there was one room that we were not able to, and partially because it was a corner room and the patient was intubated and they had CRT. So like they just had a bunch of different machines in the room that was just limiting where we could
Yeah.
put it and how we could get the Hoyer lift under the patient to get him over to the bed. But I think that's only happened like once or twice in our smaller rooms. But yeah, in the surgical tower, it's been working really well. Yeah, we've been liking it.
What were y'all doing beforehand? Were y'all doing more manual, sitting them on the edge of the bed and then just seeing if they could stand?
Yeah, so we have a couple different ways that we were approaching it. One is exactly what you said, having the patient sit at the edge of the bed and then practicing standing from like an elevated bed with two people next to them. And sometimes based on how tall or short the patient is, it would work or it wouldn't. We also have a Craig Catalyst bed that we use for verticalization. And actually some of the feedback I've gotten from staff is that they enjoyed the Moveo more than the Craig Catalyst bed because you are able to do a little bit more of the weight bearing and the squatting and practicing
Yeah.
those sit to stands at a pretty high angle.
Yeah, we say that we can do verticalization in the sense that your head is at 85 degrees and your upper
Yeah.
torso, and then your legs are at the 30 degrees, but you're able to see what kind of weight bearing, and then you put the range of motion stop up real close to where it either holds their weight or it doesn't. And so now you're either doing verticalization or what we call passive, which is, we think the other one, the Craig bed, is pretty passive in the sense that the patient's so strapped in that they're not, you really don't know what kind of weight bearing we're getting there. What about ease of use?
I would say ease of use depends on how many lines. What the weight bearing statuses are is easy to use for certain patients. I would say we need to find a better spot for it to live if we wanted one because we've been carting it around from our office to all over the hospital and that just takes time.
Yeah.
And so like we would probably have to figure out a better plan for that. But yeah, I think ease of use has been pretty good for the most part. There's been a couple like trickier situations, but I think those would have been tricky either way just because of all the lines that they have. We've had a couple of very weak patients that when we have them even just doing it flat, they're struggling. With one of those patients, we were actually able to go from flat to like a 5-degree inclination, which it's progress. So
Yeah.
that's
Is it mainly physical therapy that's directing everything, or has nursing got involved?
mainly physical therapy and occupational therapy. I will say our OTs were a little bit hesitant about their uses with it, but I think they've been pleasantly surprised with some of the things they've been able to do, like practicing ADLs at a higher inclination, but it's been a good surprise for them. But yeah, mostly PTs and OTs right now. Our nurses are definitely very excited every time we bring it up and it draws a big crowd. But
Okay. Have you had any patients request it? They've used it one time?
yeah, definitely. There's been a couple people that have really liked it and want to continue to use it. And then there's been some people that have been able to progress off of it, which is even better. Maybe one of the things we haven't been great at is actually getting the peak force for some of our patients because some of our patients are just so weak that we're like, all right, let's just see if you can just do this. And we haven't quite figured out how to navigate the peak force and then also continue to do some of the exercises with it. But I think with time that would come. Still trying to get some of our therapists to buy into it a little bit. I think some of the like fact that they don't know exactly how it works and then thinking it's a little daunting to try to get it into the room. But yeah, the people that we have used it with, it's been very successful. So
How about the video? Is the video it is pretty much what you need to know
yeah.
before you use it?
Yeah, absolutely. I do really like the video, like the QR code is right there so that
Mhm.
when we bring it up to the room, the therapist can quickly look at the video, watch it real fast, and feel like they know what they're doing going into it.
Yeah.
That's super helpful
Good.
feature.
Awesome. That's the first time we've done that.
Yeah.
It's really going to I think we should do it for all of our other products too.
Yes, absolutely. I love that feature.